Right, superbugs, bacteria and viruses that no longer respond to the drugs meant to treat them are becoming one of the world's biggest health threats. Let's take a look at some of these infectious diseases and how they're spreading globally, and also what's being done to fight back. Well, superbugs are germs that have become resistant to the medicines we use to treat infections. That means diseases are getting harder to cure. Every year, 700,000 people die from infections that can't be treated with common drugs, and that number is rising. Countries like Pakistan, India and much of sub-Saharan Africa are at the heart of this crisis. In the next 25 years, superbugs could kill up to 40 million people if we don't act now. That's according to a study published in the journal The Lancet. Some of the most dangerous superbugs include Staphylococcus aureus, which caused nearly 190,000 deaths in 2021, are still dangerous. Other superbugs like E. coli are becoming harder to treat too, threatening lives around the world. But there is hope. With better access to vaccines and clean water, we can stop the spread of these bugs. And new treatments are also being explored to tackle infections that antibiotics cannot handle. Well, Pakistan, meanwhile, is facing a new health emergency with the emergence of a superbug. The country has seen a rise in those infections, which pose a significant threat to public health because of limited treatment options. Cameron Youssef has more from Islamabad.
14-year-old Umair Khan has a fever for the last 10 days. It is not going away despite him taking medication at home. His mother finally brought him to a hospital in Islamabad.
In the beginning, I had a mild fever. I took medicine from 2 medical stores, but it didn't make any difference. Now I have come to hospital and have been admitted, and my treatment has started.
Umair is being treated for superbug, a strain of bacteria that has become resistant to antibiotics. Safia Bibi is facing a similar problem.
I am feeling very unwell. The medicines I took from the doctors earlier did not help either. My condition is still bad, with a lot of pain in my body. Now I have come to the hospital, and the doctor has said that they will admit me, and then I will receive treatment.
There are currently 15,000 cases of superbug infections in Pakistan, and authorities are worried.
Why we call this as a superbug? Because for last couple of years we are facing a medical emergency in which this bug has created a lot of drug resistance. That's why the diagnosis and the management of the cases suffering from this bug is difficult.
The issue of antibiotic resistance in Pakistan can be traced back to the early 2000s, when excessive antibiotic use, both in humans and livestock, became widespread.
One of the primary causes of superbug emergence is the unregulated sale of antibiotics. For example, you can buy antibiotics from medical stores, like the one behind me, without prescriptions. In addition, healthcare providers sometimes overprescribe antibiotics for minor infections.
The misuse of antibiotics and poor healthcare infrastructure has also contributed to the rise of superbugs. Health experts warn that if left unchecked, superbugs could lead to a healthcare crisis in Pakistan, making even common infections difficult to treat. Meanwhile, Umair's recovery is painstakingly slow from an illness that probably would not normally have landed him in hospital. Kamran Yusuf, TRT World, Islamabad.
Well, for more on this, I'm joined by Dr. Bharat Pankania from Bath, Senior Clinical Lecturer at the University of Exeter. Bharat, nice to have you on the programme again. So how much of a problem is this? Are we blowing it out of proportion, or is it something we need to address urgently?
Oh, it is a growing problem, and it is a clear indication of a failing state or a failing country when they cannot provide safe water and sanitation. And really, providing safe water and sanitation are the essentials of keeping many infections at bay. And
that presumably would lighten the load on antibiotics, which, as I understand it, have been overprescribed and therefore increasing the amount of superbugs that go around.
Indeed, and whilst your report addressed some of the issues about overuse of antibiotics, amongst patients. The elephant in the room that we are not addressing globally, by the way, is feeding animals antibiotics to fatten them faster for the market. And the use of antibiotics to fatten animals faster is also one of the big contributory factors to the emergence of antibiotic resistance. So, the European Union has banned the use of antibiotics as food, and similarly, America and the Far East ought to also follow the same route.
Am I correct in saying that there are only a limited supply of effective antibiotics still out on the market, which is to say then that we are running out and the supply is diminishing?
Well, indeed. So these bacteria, when they reproduce, under antibiotic pressure, they often develop resistance. And now what we've got is extensively drug-resistant typhoid bacteria. And as a result, it's very, very difficult to find the right antibiotic to treat them. And when we've run out of antibiotics, we've got nothing else left. Of course, we can also use vaccines. And in the case of, say, Pakistan, India, wherever you've got outbreaks, when you haven't got all those antibiotics to treat, and when you haven't got fresh water and sanitation, perhaps immunizing your population with vaccines is also a good idea.
OK, Bharat, thank you very much indeed. We hope that everyone takes that advice. Clean water and good sanitation, the key. Thank you very much.
Thank you.